It's my great pleasure to welcome you all to the first plenary session of the 2021 International System Dynamics Conference, which will be on the topic of the ongoing COVID-19 pandemic. This has been and still is a very difficult period for many people. A period during which many have lost their families or friends or still struggling in other ways, including from social isolation or economic hardship. At the same time, we have seen incredible efforts from within the health community, from scientists, policymakers, and from many other groups and individuals. And the extent of, but also variation in efforts, behavioral responses, and impacts within and across countries and at different stages of the pandemic highlights further the vital importance of effective policy that is deeply grounded in an understanding of the dynamic socio-technical complexities underlying the problems we face. In this plenary, we have 3 terrific papers that showcase the different ways by which we can better understand these challenges or influence policy through exemplary, rigorous, broad boundary, and empirically grounded research. Beyond this plenary session, the conference features also 5 parallel sessions on COVID-19 with topics ranging from policy design to social impacts, methodology, and to communicating insights. Each presentation in this plenary session will be 20 minutes, followed directly by 10 minutes questions and answers. You as audience can raise questions at any time using the Zoom Q&A button. We hope to be able to address many of those questions, though please note that this plenary session will also be followed up with a discussion session to be held on Wednesday. The first paper involves work by 3 authors, Dr. Hajir Rahmandat, who is the Social Family Professor of Management Science and Associate Professor of the System Dynamics at the MIT Sloan School of Management, Dr. Tse-Yang Lim, who received his PhD within the System Dynamics group at the MIT Sloan School of Management, and Dr. John Sturman, who's the J.W. Forrester Professor of Management at the MIT Sloan School of Management and Director of the MIT System Dynamics group. Dr. Lim will be presenting their talk titled Behavioral Dynamics of COVID-19, Estimating Underreporting, Multiple Waves, and Adherence Fatigue across 92 nations. Dr. Lim, I look forward to your talk.
Great, can everyone hear me? Hi everyone, thanks for being here. I know this plenary was advertised as being by John Sturman. I'm clearly not John Sturman, I have too much hair. But for the last year and a half, I have been working with John and Hajir to develop a model of the COVID-19 pandemic. And we'd like to share a bit about this model and how it works and what it tells us. So, despite increasing vaccination, COVID remains a huge problem. And we're seeing just in the last couple of weeks yet another wave of infections emerging. In many countries, it's a 3rd or even a 4th wave. Why do we see these patterns of multiple waves across so many different countries and yet with huge differences in magnitude? We have over 100 times difference in the per capita rate of infections or deaths. So what explains that? And we developed this model to try to answer some of these questions, as well as an even more basic question, which is what is the true magnitude of the pandemic across different countries? So to get at these questions, we developed a multi-country model of the pandemic, starting with just a basic SEIR model, susceptible, exposed, infectious, and recovered, which I think most of you are familiar with. So we start with this core simple model, and then we made it more behaviorally realistic. So we do that in a few ways. First, we disaggregate people by testing and by hospitalization. So who has or has not been tested, who has or has not been hospitalized. And we do this endogenously. So the rates of testing and hospitalization depend on the capacity for testing or hospital capacity available. Now, this creates an allocation problem because testing and hospital capacity are not allocated randomly, right? Instead, usually it is the more severe cases that get priority. But what that means is that the flows of people who are getting tested or hospitalized are actually systematically different from the flows of people who are not. And that difference is going to be dynamic. It's based on the capacity available. So that's a tricky problem. And we deal with that using a Poisson approximation where we represent the disease severity with a Poisson distribution. And that lets us solve this problem numerically. I'm not going to go into details here. Details can be found in another paper by Hajir. And the different states of testing and hospitalization then endogenously affect disease transmission. So for instance, someone with a positive test result is more likely to be quarantined or self-isolate than someone who does not have a positive test result. And we also add one really important feedback process, and this is the behavioral response to risk. So as the threat of the pandemic gets worse, with more deaths, more risk of infection, then people are going to stay home, they're going to wear masks, avoid large gatherings, and so on, whether they do that voluntarily or because of government mandates, government policy, right? They're going to try to reduce their exposure either way and bring down infection rates. On top of that, there's also some adherence fatigue. So as the pandemic wears on, people get habituated and they become less responsive to risk. So that's a very quick overview of the main structure of the model. And what we did was we replicated this structure and estimated it for each country across 92 different countries, covering about 5 billion people. And we calibrate the model to reported infections and deaths. We treat testing and a couple of other country characteristics as exogenous. And then the actual estimation is by MCMC, Markov chain Monte Carlo. We use a negative binomial likelihood function, which helps address over-dispersion in the data. But most importantly, we do this with a hierarchical Bayesian approach. What does that mean? That means we treat each country, in effect, as an observational unit. And so we have model parameters that are coupled across different countries. We actually have 22 country-specific parameters, where each country's value for each of these 22 parameters comes from a shared distribution, and that distribution is shared for a given parameter across all countries. And we specify a prior on the variance of that distribution, which reflects how much that parameter could plausibly differ across different countries. So for example, if you have biological parameters, things that reflect the properties of the coronavirus itself, right? We don't expect, or at least before we got a lot of new variants emerging, we don't expect those parameters to differ much across different countries. So for example, the sensitivity of fatality rate to acuity. This is basically how much more deadly are more severe cases of COVID. Each dot here is the estimated value for one country, so that's all 92 countries. And what you see is there's not much variation between countries, right? All the values are close to identical, and there's much more uncertainty within each country's estimate than there is variation between countries. On the other hand, for social or behavioral parameters, for instance, the strength of adherence fatigue, so how quickly does adherence fatigue kick in? How quickly do people relax their risk response? There's much more variation here between countries, and that might be expected, right? So this hierarchical approach basically lets us take advantage of the fact that countries differ in many different ways, but what's going on in one place can still provide useful information, at least in some ways, on what's going on in another country. And that's a very powerful approach. It's also, of course, a very complex approach. So to try to build more confidence in this, we did a synthetic data analysis. And what this involves is we first generate artificial data that are similar to the real data, but for which we know the true underlying parameter values. And then we rerun the whole estimation process on those artificial data and see how the results that the estimation process gives us compare to the known true parameter values that were used to generate the data in the first place. And what that does is it lets us basically benchmark how well our estimates of uncertainty are actually doing. Are they so underconfident as to be useless, or are they so overconfident as to be just plain wrong, or are they in fact reasonable? And by and large, we find that they are. So if you look at the theoretical accuracy that we would expect from perfect estimates, that would be the one-to-one diagonal line, against the accuracy we actually achieve, our curable intervals are doing fairly well. We are underestimating, they're a little bit too tight, but overall it's pretty good. Our colleague Tianyi Li has actually done some great work benchmarking different estimation methods using exactly this sort of analysis. He's presenting on that tomorrow morning if you want to learn more about that. And actually compared to his benchmark results, which attend his presentation and you'll see, this model estimation is doing really very well. So that gives us some confidence in the overall estimation method. And now that we have that, let's look at some results. So we can look at results for each country, and we compare the model's simulated reported cases and reported deaths against the actual reported cases and reported deaths in the data. So this is just one country, this is Italy, right? The left side gives you reported cases per million per day. Right side is reported deaths per million per day. And overall, what you see is it's a decent fit. We have, most importantly, the two waves, the pattern with two waves that you see in the data. The deaths fit very well. The cases fit reasonably well. They're overestimated a bit in the first wave, underestimated a bit in the second, but overall, it's a pretty good fit. And we see this across most countries. This is 16 of the 92 countries. These are the 16 with the largest outbreaks. And by and large, whether you're talking about a pattern of one wave or two waves or three, we're doing pretty well. If you're wondering, by the way, why there's some noise or some spikiness in some of the countries like Mexico or Argentina, that's because they have very strong weekly cycles in testing, and the testing cycles affect the reported infections. And that then affects the model's output. So fit to data is not bad, but we can also check the model's performance using a holdout or out of sample data analysis. So what this means is we estimate the model using data up to a certain date, and then we make projections using those estimates, and we compare the projections to the actual trajectory. And so here what you see is for one country, this time it's the US, you see cases on top and deaths below. The light dotted blue lines are the credible intervals on projections, and the dotted black line, that's the actual trajectory of the pandemic. What you see is that the actual trajectory is largely within the credible intervals projected. And again, that's true across multiple countries as well. On the whole, we have about 70 to 75% of the actual trajectories falling within the credible interval, which when you consider that there's a very wide range of behavior modes here, whether it's single waves, double waves, in some cases, one wave in the observation period, and then a second wave emerging only later. There's a very wide range of behavior modes here. So 70 to 75% accuracy is also reasonably good. So on the whole, we can see that the model performs fairly well, and that gives us some confidence in its underlying structure. So with that confidence, what else can we learn from this model? Well, our starting question here was, what is the true magnitude of the pandemic across different countries? And here we have an answer. It's overall about 7 times larger than reported. This is as of December. Last year in July, it was closer to 10 times, and the ratio has actually been coming down over time as test capacity has improved. We also see about 1.5 times more deaths than reported. But this 7 times number, this is just the global average. There's actually a very wide range of variation across countries. And if we zoom in on a few of them, if you look at, for instance, Mexico as well as several other Latin American countries, for a long time was doing very, very little testing. And so they were underreporting their infections by a lot. And by our estimate, they had about 30 times the number of infections as officially reported. Other countries were less extreme. Italy, for instance, had about 5.5, 5.6 times. But actually every country, even the ones that are doing fairly well, like New Zealand, for instance, every country has had substantial underreporting. And a lot of that is because many cases are asymptomatic. About half of all cases are asymptomatic. And on top of that, testing is also of limited accuracy. So you get false negatives as well, and that results in further underreporting. Overall deaths are more accurately reported. There's less variation in that between countries, but there's still some underreporting of deaths as well. Another thing we found was that fatality rates on the whole have declined over time. There's been some fluctuation in that. The fluctuations are primarily due to hospitals or health systems getting overwhelmed because when you need a hospital bed, your ability to get one actually makes a huge difference to your survival chances. The overall decline, however, is due in part to a learning effect where hospitals and doctors have gotten better over time at treating COVID cases. But there's also a self-selection effect where the people who continued to get infected over time tended to be those at lower risk, relatively speaking, because those people were taking fewer precautions. So for instance, later and later into the pandemic, we saw more and more, a higher and higher proportion of younger people, for example, getting infected because they were taking fewer precautions. So there's this behavioral response as well. We can also use the model to look at counterfactual scenarios. So basically run counterfactual historical cases. First case we tried was, what if we had more testing early on? Because if you think back to March of last year, the shortage of tests in many countries was kind of a big deal. And what this shows you is cumulative cases and cumulative deaths over time. The solid line is the base case. The heavy dashed line is the counterfactual case. And what you see is if we had more early testing, that would basically have shifted the overall trajectory of the pandemic down a little bit. And that's because early testing would have helped with recognizing the scale of the problem faster and responding to it faster. And so that would have saved about 160,000 lives overall. But the overall trajectory of the pandemic, you can see the line still goes up, and it would have unfolded more or less as before. What would have made a bigger difference, though, is if we'd been able to avoid adherence fatigue. In other words, if everyone was still being as careful and as responsive about COVID and taking it as seriously as we did early on in March of last year. And that's the dotted line that you see here in these graphs. And what you can see is it wouldn't have made much of a difference early on, but over time you have a greater and greater effect. And in fact, without adherence fatigue, if we'd been able to avoid that, we would have averted about half the cases and deaths that we had up until December, about 1 million deaths. So that's a lot. And of course, going into the first few months of this year, the effect would have been even greater. And we see a similar pattern in projections as well. So these were forward-looking policy scenarios, where we projected from the start of this year. We tested a vaccination scenario, which is the light dotted line that you see, and we assumed the whole world gets vaccinated over the course of this year, starting in January. That, by the way, is, or it was, and it remains a very, very optimistic scenario. And overall, what that would have achieved, or what that would achieve, is some reduction in deaths, but only a very small drop in cases, only 6%. And the reason we see such a small drop in cases is because with vaccine rollout, there is a relaxation of risk response. And we've actually seen that, right? People have eased up on social distancing, on travel restrictions and all that, because we've got the vaccine now, right? So that creates something of a rebound effect. Now, that's not to say vaccination isn't critical, right? It absolutely is, but it's not the only piece of the solution, because increasing people's responsiveness to risk has an even bigger impact. And that's the dashed line that you see. And it would result in an even greater drop in deaths than vaccination and a much greater drop in total cases than vaccination on its own would. So what does this increase in responsiveness actually mean? Well, responsiveness is basically how sensitive are people and governments to the threat of COVID. So to put it another way, how much are they willing to reduce their contact rates for any given level of perceived risk? So a 20% increase in responsiveness results on average across all countries in about a 7% reduction in actual contact rates. 7% reduction in contact rates is roughly comparable to the effects of mask use. So if everyone consistently uses masks, that's the amount of difference that it would make. So it's really not a huge change in behavior, but it can have a really tremendous impact. So all of these results and more are in the SDR paper, which we published earlier this year. But since then, we've continued to update the model to better account for vaccination rates, the emergence of new variants, and we've also made the model accessible through an online simulator, which you can explore for yourself here. You can use it to look at the impacts of different vaccination scenarios. I'm not going to go through the interface in detail, but it is documented through that little button that says Notes and Details. You can find all the information there. And we continuously update this with latest data and structural changes to the model usually about once a month. So take a look at this, explore, let us know what you think. Okay, so that's all about the model. To wrap up, I'm going to hand you over to Hajir. He's going to share a few reflections on the model and the modeling process.
Thanks so much, TY. This has been a fun journey for us. It's essentially more than a year now that we have been actively working on this project. And I just wanted to kind of take a minute to think about kind of what are some of the process lessons that has been useful for us going through this. So let's click through it. So the primary contribution of this work and the contribution of System Dynamics to this research is providing a more global view of what COVID-19 has been doing and what's the magnitude of it and what are the potential future trajectories. Why do we see so much heterogeneity in deaths and cases across different countries? And to get to these contributions, we have kind of had a few components in our research that I think are important to have a broader impact in the research community. So first of all, this has been an amazing research journey for the global research community in terms of being really responsive. So from the first days that the pandemic started, research teams across the globe has been working tirelessly on various aspects of COVID, and we had to build on that work to have anything meaningful to say. So from kind of papers in January and February of 2020, we were starting to build models and estimating various basic parameters of the epidemic, and we couldn't have built any of our work if we didn't build on that in the first place. Another piece of it that I think is a little bit more kind of key to system dynamics contribution is taking these behavioral feedback mechanisms more seriously. Many epidemiological models have a lot of detailed complexity, but are missing some of these feedbacks. And I think that's an important contribution of the work. So that comes from the core SD mindset that we bring. But also we had to seriously connect the model with data. So getting to bring data from multiple countries so that we can essentially leverage from data from one country to inform what is happening in other countries using this Bayesian hierarchical estimation method that we used, and then taking the confidence interval issue seriously, validating that through synthetic data. All of those are needed because what we are estimating, there is quite a bit of uncertainty around it. You cannot really just put a number on it. Another important kind of part is to doing out of sample prediction tests and validating the data against seroprevalence data. And finally, this has been process-wise a pretty iterative process that we had to go through it by getting feedback from the community, sharing the paper publicly a year ago, and then going through multiple iterations throughout. So next slide. I think within this feature kind of set of process points, a few of them are well recognized in the system dynamics community, both in terms of having an iterative process, engaging the stakeholders from early on, but also capturing behavioral feedbacks seriously. These are things that our community knows very well. But I think next slide, there are other features that our community can do even better. So those are related, so next slide, they are related to closer connection with data and building better bridges with what is already out there. So let me stop here, and I think we have a little bit of time for some questions and answers.
Thank you very much for this wonderful talk. We have certainly time for questions. Already questions have been coming in the question and answer feature, and so if you have more questions, please add them. So I'll start with the first one. Is how the question is a question by Andries Bota. How did you address the travel between countries and the potential impact? And so this is a question about travel between countries.
So in short, we did not incorporate travel explicitly in our model. And basically, once the epidemic is seeded in various countries, travel really doesn't make a difference. The magnitude of travel is not large enough that beyond seeding of the epidemic has any quantitative impact on the trajectories. And given that it essentially has been seeded across the world, travel is really of a secondary consideration. So that has been our assumption, and that's pretty well recognized in the epidemiological model.
So Hajir, can I just add to that quickly? So we do model when the virus arrives in each country. That's an estimated parameter, but Hajir is exactly right. Once it's here in your country, it doesn't matter whether a few more cases arrive. And the policy implication of that is that travel bans generally are ineffective. And the reason for that, of course, is the time delay between when people are infected, when they become symptomatic, if they ever do, when they might be tested. And that time delay means you really cannot seal your borders against this or other pandemic diseases.
Thank you very much for those answers. So there's a number of questions that address the questions around the variant, the emergence of variants. You did mention that briefly in the paper, but could you say a little bit more about how they were incorporated in the model, what you're doing about that?
So in the original paper that we published in the System Dynamics Review, we do not capture the variant emergence, but in the updates that we have been doing since then, we do allow for a variant and not multiple variants because there are too many degrees of freedom, but one variant emerging in each country at different times, depending on when the variant becomes salient in that country, and that we estimate empirically. So the version that you see online, and the link is on the screen, does include the emergence of a variant, which is closest, the Delta variant is closest represented there. So that's the basic assumption right now in the model.
There are also some questions around false positive and false negatives. And so what are the data on that? And perhaps as a follow-up then, how this matters for the dynamics.
Why do you want to take that?
TY?
Yeah, sure. So so overall, false positive rate is actually very, very low. False negatives are much higher. We account for a sensitivity of test of about 70% or so, which for across different types of tests is about right. And so false negatives essentially mean that you get a large number of cases where people are infected, sometimes even symptomatic, but don't receive a positive test result. And that positive test result could potentially make a big difference to the behavior because, for instance, you would quarantine or you might self-isolate, you're more likely to get hospitalized and so on if you have that positive test result. And so false negatives mean that obviously some people who are infected end up not having their behavior and outcomes changed in that way.
Thank you for that answer. There's a question around the behavioral response. Of course, there's many actors that respond, but one category is government versus individual behavioral response. And did you separate that? And to what, if so, yes, to what extent? And any lessons learned or any thoughts on that?
Take that.
Sure. Basically, we didn't really separate government from individual behavior for the reason that essentially if individuals perceive a greater level of risk than the government, they're always going to behave in a more conservative way. And so it's essentially the overall risk response is essentially whichever is greater between what the government is enforcing and what people themselves are willing to do. Because if you think about the other way as well, right, if the government has a policy but people don't actually believe the risk is that great, they're just not really going to adhere to that policy very well. So overall, the combined effect of it is essentially kind of a balance of what people will actually be willing to do under the circumstances, whether that's greater or lesser than what the official government policy at any given time might be.
There's also a question around engagement. You've mentioned many aspects around the journey and also about how this kind of work can make an impact. And the question is specifically around how will you engage with a bigger audience?
So a few things that we did was, first of all, sharing our work as soon as we could, that we had a working paper with the academic community and researchers involved with it and getting their feedback and trying to incorporate that feedback. Secondly, we reached out to various media outlets through the channels that we had through MIT, Sloan's system and other channels, so that the work got actually quite a bit of coverage in media across the world. We had blog posts related to it. A third channel is related to use of the online simulator and sharing that more publicly so that folks can use that and kind of do their own test runs. John, do you want to add anything to that?
I think that's basically right. We received a fair amount of media attention, including a write-up in Nature in July, various other high-profile media outlets around the world. But I think you covered it. Let's move on to some other questions. Jeroen, there's some interesting methodological questions.
Yes,
too.
Exactly. I was just getting to One of the questions about sort of what's the best learning more about using Bayesian hierarchical estimation in SD models. So maybe you can say more about that.
So Hajir, can I take a quick, make a quick high level comment on this? And that is that in a highly consequential context like this, and many others that we as a community seek to apply system dynamics to, it's essential that the models be grounded in data of all kinds, quantitative and qualitative, and that the parameters be estimated in some fashion that is reliable, and that the accuracy of those estimation schemes are evaluated. And you saw TY explain the synthetic data experiment and others. And parameter estimation does also require that you estimate the uncertainty around that. And so MCMC was absolutely essential here. And I would urge anybody who's doing any system dynamics modeling of any context that matters, and hopefully nobody in this community is modeling things that don't matter, to do this. It's just not acceptable anymore to fail to estimate your parameters based on the evidence, or to estimate the uncertainty around your estimates.
And just quick, I think kind of the technical details are probably too much to cover in a Q&A. I would certainly recommend that you look at the online appendix of the paper that documents everything that we do in detail. But briefly, it is not a huge learning cost. Essentially, TY, John, and I created and learned these methods as we were doing some of it. I mean, of course, we are learning from the statistical literature and how to do it, but it was a relatively rapid learning curve. And once you have done that, you actually have a whole infrastructure for running this very efficiently for your future projects. So TY and I have been involved in a couple other projects, and we are using that infrastructure. It really speeds up our work significantly. So it's a very cost-effective investment in terms of upscaling your skills related to estimation. I would certainly recommend that, building on John's.
Also, Tianyi Li is presenting a paper later in the conference in a parallel session that uses a synthetic data experiment to look at the different methods for estimation, including standard naive least squares, which does not work very well, common filtering, and all the other techniques that we used in this work. I recommend that paper and that session.
So with that, let me thank the presenters and the authors of this first talk, which was terrific. And I realize that not all questions have been addressed. I do want to emphasize again, there will be a discussion session. In fact, I erroneously said it was Wednesday. This will be on Tuesday, July 27th, 7 p.m. EST, 6 p.m. Chicago time. Let's go to the next talk, which is given by Dr. Charles McCall. Dr. McCall is a distinguished fellow and chief scientist and social behavioral and decision science group leader at Agron National Laboratory. The title of this presentation is Responding to the COVID-19 Pandemic, Epidemiological Modeling on Speed Dial. Dr. McCall, I'm looking forward to your talk.
Thank you very much. I'm in the process of sharing my screen, and can you see my screen?
Not yet.
Okay.
On the bottom of your screen is a share screen button. When you press it, it'll bring up a dialog asking you which desktop you want to display before
Right, okay.
you displayed your second desktop.
Yes, right.
Something's happening, yeah.
Okay.
Great.
Okay. So sorry about that. We rehearsed this, and of course, you know, I still got it wrong, but okay, okay, excuse me. Yeah, okay. Well, good morning, everyone. My name is Charles Makel from Argonne National Laboratory, and I'm pleased to talk to you today about some of our experiences in epidemiological modeling on speed dial, and share some of our experiences in the epidemiological modeling that we did that was directly supporting decision-making in Chicago and Illinois. I'd like to thank the conference organizers for the opportunity to speak today as well. It takes quite a team of people to do something like what we had done, including the modeling, the data analysis, the estimation, and there are many people involved from Argonne. You'll note Dr. Ignacio Martinez Moyano, prominent in the system dynamics field, and this conference is one of the people that is on the team, as well as University of Chicago, which we relied on for a lot of epidemiological subject matter expertise. Okay, so. Okay, here we go. Basically, what I'm going to talk to you about is a large-scale agent-based model called CityCOVID. And CityCOVID models the spread of COVID-19 to understand not only what the forecast could be, but also what the effectiveness of interventions could possibly be. We are modeling the spread of COVID-19 in Chicago to support city, county, and state planning. We engaged very early in the process with the city of Chicago and with the state of Illinois in particular to basically be their epidemiological modelers. This was a case where the decision makers sought out modelers, and we've seen a lot of basically a lot of public health organizations are looking for, teaming up with modelers to at least try to understand what the science says, what the data says, and get some input in that regard. So in CityCOVID, we modeled the entire population of Chicago. Sorry about that. I talked too long apparently so far. 2.7 million people are modeled as individual agents. They move on an hourly basis between and among 1.2 million actual places in Chicago. Questions have to do with what are the outcomes of various interventions. Early on, the question was, when will the peak occur? As if there is only going to be one peak. How large will that peak be? And then, we collectively got into this notion of, well, how are we going to level the curve, so to speak, through the various interventions we could possibly take. We're modeling people's activities in terms of where they go to and from during the course of the day, as I mentioned. And when people are co-located in the same place, they're essentially having contact with each other and offer the opportunity for infected people to infect susceptible people. Now, my story begins very briefly with the Ebola outbreak in West Africa that began in 2014. At that time, I was part of two federal task forces, one for the Department of Energy, the other for BARDA, which is an HHS. They were trying to understand the course of the outbreak and what could be done to stop the Ebola outbreak. Although many modeling groups at the time were focusing on efforts in West Africa, my particular focus was on understanding what could happen if Ebola came to the United States. And fortunately, it did not in any major way. However, from this engagement, I always remember a couple of things that were said by Dr. Richard Hatcher, who was the chief medical officer of BARDA at the time. First, he said, decision makers at the highest levels of government are asking, and they are asking for the first time, what do the modelers say about the course of the outbreak? This situation spawned basically the research I'm talking about today on COVID. And the second question was, when Ebola was finally winding down in January of 2015, and all the task force were being disbanded and all the government workers were going back to regular day jobs, the repeated phrase was, it's not a matter of if, it's a matter of when. And this really spurred our modeling efforts at Argonne to continue moving forward from that day. And essentially, we were positioned to take on the COVID situation when it began. We were very fortunate in Illinois that from the beginning, Illinois, as stated by the governor, Illinois' response is guided by data science and public health experts. So that was very helpful in facilitating our work on COVID. Basically, Illinois is divided into 11 emergency medical service regions. and you can see them enumerated on the map here. Chicago, because it has most of the people, well, it has 2.7 million people that live in the city proper. There's 12.5 million people for the state altogether. And there's about 7 million people that live in the 7-county area in the Northeast region of Illinois. But Chicago has its very own region, Region 11, and it's basically, so to speak, administered by the Chicago Department of Public Health, which I said that we work with. Overall, the modeling groups that have been formed for Illinois do cover the whole state. We're just focusing on Chicago. So throughout the pandemic, there were a series of key questions being raised by decision makers, which were basically our goal was to address, such as the importance of individual protective behaviors, mask wearing, 6-foot distancing, etc. The behaviors we saw different age groups, was mentioned earlier, which affect transmission. Children at schools are a big issue. Should schools open? Should schools close? 18 to 40-year-olds have been noted as sometimes not adhering to the protective behaviors that have been advised. And there's an issue, also a major issue, about what is the role of activity and contact versus individual behaviors, or I would call it the quality of the contact. So the number of contacts, the quality of contacts, those are the two key factors. Of course, there's many questions about timing of imposing, lifting interventions, shutdowns, reopenings, all that. Contact tracing was an issue for a while. Vaccine programs for maximum effect, who gets vaccinated, when and how, etc. And that, and now the key questions really have to do with the impact of the variants, whether it's the original Alpha variant from the UK or the current Delta variant. And, I was reading, of course, we have the Lambda variant, but we don't have enough data on that one to see how severe it is. But here's basically a conceptual way to think about the city COVID model. Every person is represented as an individual agent, and that agent goes through the course of its day, going to various places throughout the city and outside of the city as well, whether it be going to work, going to school, going to the hospital potentially, etc., or just staying home. And what we do then is this is basically the disease state transition diagram. You could recognize this as a souped up SEIR kind of diagram, but susceptible people start on the left. The model, city COVID model in particular, models the contacts people have at locations, which results in a certain number of people possibly becoming exposed. And then the different routes through the disease states are modeled here, including the possibilities of asymptomatic contraction of COVID, or pre-symptomatic that either results in severe cases, which kind of by definition, severe cases go to the hospital, potentially going through the ICU units, even requiring ventilators, etc. But in the end, there's outcomes of deceased or recovered as to whatever process, what path one has gone through. So, we've, like everybody else is doing COVID modeling, they've looked at the literature for how long all of these states typically take. We have data from the city on the branching parameters by age for each group, which is critically important, as you know, because people over 50 generally have a higher proportion of severe cases than people that are under 50, and most of the deaths have been really registered for people over 60 or even 70. In any case, I just wanted to draw this very brief connection to system dynamics. We also have built a system dynamics model that exactly reflects the disease state transitions. Dr. Martinez Moyano did that. This is his role in the project. And we're working very closely with the system dynamics model, the agent-based model, to help inform our understanding of the whole situation. And the basic concept is, as you know, system dynamics would model disease states at the aggregate population level. One could have perhaps compartments which are actually in the model by age group in the system dynamics model as well. The agent-based model takes exactly the same disease states and assigns them to the individual people, though. So every person has some state that in the model that they're going through at any particular time. There's a very close connection here. Of course, under many circumstances, you'd like to see the results of the system dynamics model, the agent-based model match, and that's very helpful for both verification and, to some extent, producing some insights into the process. But the one key difference between the modeling approaches is simply in how we compute who goes from susceptible to the exposed state. We do it very mechanistically, we would say, by people in the same place, having contact, etc. System dynamics model takes a more kind of aggregate approach to that process. In the agent-based model, the basic idea is simply we have persons, we have places, we put them together, we connect them with their activity schedules, and then people move around during the course of the day in the model, results in co-location and contact, and then there's a probability of infected people infecting susceptible people. We call it the dyadic probability, of one infected person infecting one other susceptible person. The entire rest of the contagion model, as I call it, is built on this dyadic probability, which results in a model that when you have n infected people and m susceptible people and have contacts, you can build the probability models on that, which are fairly standard, fairly well known. In terms of the demographics, we have a small number of parameters on each individual, including age, race, ethnicity, gender, zip code. Also structure, we identify who is technically essential workers and who's in the vulnerable population. And these demographic factors can be used to determine the disease state outcomes in the disease transition flow chart that I showed earlier. In terms of the places, these are available data sets actually, which require some data, some effort to doctor up, so to speak. But what we've done in terms of places is to represent the significant places and place types which have been implicated in transmission of COVID-19. Together in a schedule, as I mentioned, which indicates place for a person to be, what activity they'll engage in, what context they might have, and then possible transmission. The schedules themselves are more difficult to construct. That's not public. Well, it's based on publicly available, like the American Times Survey Panel, Survey of Income Dynamics for Children. We did use SafeGraph data also that was publicly available to provide a current type of, let's say, activity scheduling that's out there in the field. Yes, it was mentioned, John Sterman mentioned about the importance of model estimation. The main effort in our entire work is to estimate the parameters and calibrate them to real data. We use procedures that are similar to MCMC, but they're numerical in nature. And we implement them on basically our supercomputer at Argonne because it's a really high performance computing task. So we have about 9 parameters that we estimate. And we estimate the parameters to align the model outputs to the actual data on deaths and point prevalence hospitalizations. Those data are published every day by the Chicago Department of Public Health, so they're readily available. That's basically all the real data we have. So essentially, we're estimating the model parameters probabilistically or by distributions of model parameters so that we get a good fit in terms of the model output to these two trajectories. I would say our forecasts based on this estimation process have aligned closely with the actual data. And it's given us a lot of credibility, of course, with the Chicago Department of Public Health. Okay, so our time is moving on here. I wanted to show just a few results to indicate we do have results that are really interesting, but one of the things that we've distilled for decision makers are simply the key metrics that they look at. They're, of course, public health decision makers, and I'm speaking of like professional epidemiologists and analysts at the Chicago Department of Public Health. You know, they're overwhelmed with information and data, and their whole job is to make sense of it. So what we have determined is that the key things they're interested in are hospital admissions, so they can plan in advance or inform hospitals of what's coming. And that includes ICU utilizations. They're interested in new cases or new infections. What the model computes, of course, are actual new exposures. What the data out there on new daily cases are just what people have been able to measure or report, et cetera. Another factor is deaths, because that's hardcore data in terms of COVID-related deaths. And for those of you familiar with epidemiological modeling, probably the key parameter is what's called the R effective value, or R naught. And in the agent-based models, it's given us the ability to stratify that by age group. So yes, so basically R effective in a nutshell is a measure of how many people an affected person infects during the course of their infection. So anything greater than 1, as you know, leads to basically exponential growth. Less than 1 means decline, basically. And 1 means the epidemic just kind of plodding along and continuing. By the way, our effective has been around 1 for quite some time. You know, in this recent interlude from the last peak that we had, now it's going up, of course, for at least some groups in some places. So we've basically quite a set of experiments. We engage in design of experiments, so to speak, as to what simulations we're actually going to run with the model. One of the approaches that we've taken is simply to make assumptions on people's behavior. We don't have a feedback loop for behavior embedded in the model. We didn't have data to do that. We can do that with the data. Yes, but you know, so what we've done is to do various scenarios where we've looked at adherence to protective behavior that people might have in Chicago, and we vary that to understand. So here we have, basically we have results on the left that show under one scenario, new infections continue to go down if people engage in strict behavior adherence. On the far right, if people relax their adherence to protective behaviors, meaning less people wear masks, there's a higher probability of infection upon contact, then the course of new daily cases goes up. So this is information of great interest to the decision makers. By doing our design and considering multiple factors and scenarios, we consider interaction effects of different factors, which we have found them to be very nonlinear, basically. This is a combination of factors. And as I said, we can actually compute our effective values from the model by age group and indicate, you know, what's going on with the various age groups with respect to likelihood of moving the pandemic forward or increasing infections. Okay, conclusions. You know, I think my focus, it's all about building resilience and readiness for the next pandemic if we can't get this one right. We need to know the questions of the day decision makers are asking. What we need to do is provide answers and information from models and analyses. We need to do it quickly in a form that decision makers can understand during the time window of when they're making their decision. We need to explain the reasons behind the answers. You know, we can't just say, well, the model says this or that. And we need to communicate the uncertainties in the forecast, just like we communicate weather forecasts. So thank you very much. and I look forward to your questions.
Thank you, Charles, for this talk. And yes, with that, let's go to the questions and answer sessions. And a number of question and answers have already come in. Let's start with the first ones. The first, there's some questions regarding the heterogeneity of the population, which I guess is really, a key point in relation to going for an agent-based versus a compartment level model. And so some questions are regarding the susceptibility of the different actors, and what are assumptions regarding that in terms of age groups. And there are some different questions like that. Yeah.
Okay, well, I can answer the question broadly. A large part of our efforts do, have to do with developing what we call a synthetic population, as I mentioned. So this is basically, the synthetic population is what corresponds to all the people in Chicago as individual agents. We have several synthetic populations, by the way. We do have Chicago. We have the entire Cook County, of which Chicago is in. We have the 7-county area as well. Starting synthetic populations, so to speak, are available for every county in the United States, from RTI, for example, which is our primary source, or there are some available from CMU as well. So we begin with a synthetic population for the whole region, which includes, like the key demographic characteristics of people. It also includes the places in a region as well. So in terms of the heterogeneity of the population, well, that does correspond to basically the census data, which we begin with, and we supplement that with specific analyses and studies. For example, there was a lot of work that we did to identify who's basically an essential worker, because even during the shutdown in Illinois, basically 50% of the of people were still going to work because they were in essential industries, which included everything from, hardware stores to, life-saving kind of endeavors like police and fire and emergency, et cetera, as well as hospitals. So there's a heck of a lot of essential workers out there. And one of the questions that we were going to address had to do with, which we're still working on actually, had to do with the imbalance in the, certain demographic groups were exposed because they were more likely to be essential workers, and what that impact is. So one last point, the data on, let's say, deaths as well as hospitalizations by age group is available through our contacts with the city and the state as well. So we use that to seed the parameters, some of the parameters in the model that we regarded as fixed values, as opposed to the ones that we estimated that I'd mentioned. Okay, next question.
Pardon. There's a number of, pardon me, I was muted. There's a number of questions regarding the difference in similarity and the different insights, perhaps, from compartment level modeling and agent-based, or at least at the fine-grained level modeling. So did you actually have a really comparable model, and did you get some insights from using those two models and comparing them?
Well, yeah, I mean, part of what we were trying to do was to simply have both of the models produce the same results for, given the same kind of inputs. So one of the things we did was to take the new exposures on a daily basis from the agent-based model. Sorry, my screen keeps flashing. It's on a timer. I don't know. So we took the new daily cases from the agent-based model, which is based on this very complex contagion model, contact model, and we began running the system dynamics model with those values to ensure that we were getting the same ultimate outputs on the number of people, the key parameters, hospitalizations, deaths, recoveries, etc. We have not, let's say, calibrated the system dynamics model at the actual contact level, to get those, to get those beta values, or the infectivity and the contact values you typically have in a system dynamics model. It would be interesting to derive those so that they would actually match the agent-based model as well. The relation between the two models, there's just a lot of great, interesting work that could be done there that we simply haven't gotten to yet. I mean, we actually are, and we did provide results, and we still are, to the Chicago Department of Public Health every 2 weeks, an update, and anything in between that's significant. So we're still working closely with them, kind of on a production line basis, you might say.
One very short question. Can you say a little bit more about connecting with policymakers and using your model for practical decisions? If you can do it in 30 seconds, that would be wonderful.
Okay. Well, first of all, you have to have decision makers who are coming to you, are saying, hey, you got anything for us, you modelers out there? We want models. That was the case with us. We were fortunate, as I said, for Illinois. Okay. I'm not sure if you have public health officials who are not aware of modeling or against modeling even, I don't know even if it's possible to proceed. So, but in any case, we had this advantage of having decision makers who were inclined to model. So, a couple of things, you have to answer the questions they're asking, right, in a timely manner. And that was key. And then if the answers you're providing, make sense to them, or it might even be consistent with the policies they're already imagining, then that creates, the trust. It's all about trust, right? In the end, and then establishing credibility. So
sorry for interrupting. I would like to end it here. We can continue the conversation at this discussion session. And thank you very much again for your presentation, and thanks for the questions. Let's go to the third paper, which will be presented by Dr. Mila Getmansky-Sherman, who's the professor of finance of the Isenberg School of Management at UMass Amherst. She will discuss joint work with Monica Bilio, Andrew Law, Loriana Pelizon, and Abafzal Zarei. The title of their paper is Global Realignment in Financial Market Dynamics, Evidence from ETF Networks. Dr. Getmansky-Sherman, I look forward to your talk.
Great, thank you very much. Thank you for the invitation. Can you guys see my screen? Yes.
Yes.
Perfect, thank you very much. And it's a pleasure seeing many familiar faces, even though it's on the small Zoom screen, but hopefully we can all reconvene and meet in person next year. Thank you very much again for inviting me to this important plenary discussion. And we heard a lot about COVID dynamics, and financial and modeling, and the importance of models. And as it was just mentioned that while some policymakers might not be interested in models, or we need to convince them. Well, what I wanted to show here, that now the boundary of COVID and modeling expanded to financial models. And when it hits people's pockets and understanding it, they know it, right? They will actually understand that such modeling is very important, and they need to incorporate it in their thinking. How to connect my talk to the previous talk is that the flow of new cases, COVID-related cases in different countries, which we actually model, is directly related to financial implications in those countries, and specifically the standing in the world. So the paper is going to focus on kind of global realignment in financial market dynamics. And what we heard today directly impacts that. We also have other hypotheses, right? So it's not just only epidemiologically epidemiological forces that impact financial implications were others. And actually at the end, since we're still finalizing the paper, I would open this question for discussions because would love to hear from you maybe other types of hypotheses that you think can lead to the to what we find. So the preface of the paper is really kind of political economy paper here. Is we're talking about the centrality of United States, the hegemony of United States has been pretty much it has been pretty much there for a long time. And I'm citing here the, for example, Rapak and others, they found pretty much the United States was the center, has been the center of a world, global financial system for many years. And it has actually not been challenged up until recently. So specifically what we're looking here is stock returns, right? So we're looking at the returns and we will look at each country's returns. But in this case, for example, if United States is the center of a financial network, so it means pretty much the centrality of United States is the highest compared to everything else. What does it mean actually? What does it really mean to average person? It means that if something happens in the United States, be it some developments or the markets move up or down or some political instability, it's going to spill over to other countries, right? But not vice versa, right? So before, when you were sitting here thinking about our, say, portfolios or where to invest or even saving for retirements from United States perspective, before looking at other countries was more interesting for diversification, but not from a point of view that they're actually going to affect the United States. And that is changing. And what we're actually going to find here is using the actual data on COVID cases and also political events, but actually that shift started to happen, and we're actually moving to other countries, taking a place or at least sharing the financial system with the United States. So we revisit the literature on the leading role of the United States in financial markets. We replicate and extend previous studies, and we also use new types of methodologies to study this effect. Also, what we're doing here compared to, say, other studies that only look at monthly or daily, even, we're looking at high frequency within the day. Why is it important? Because in finance information, it's really flies, it's really shared very quickly. So if something happened a minute ago, somebody can trade on it. And the information, and specifically the financial contagion, can actually move rather quickly across different countries, right? Using especially high frequency trading and ability to access information in real time everywhere, we can have a financial implications that go for countries very quickly. So our main findings is that U.S. leading role, specifically in financial market, the stock market is waning, is going down. The world is moving more from a unipolar to either bipolar with China or even multipolar system. That's what we are finding now. And again, it's not just happened today, right? The dynamic kind of the dynamic what we learn, system dynamic stock and flow diagrams, the feedback effects that have been leading to this, they have been going on for many years, right? But what we're seeing now is exactly the aftermath of those dynamics. And what we find specifically, it started shifting around 2018 with US-China trade wars and specifically the outbreak of COVID-19. We use both monthly data to replicate previous results, extend them, but also our new data and our new contribution is using minute-by-minute returns, and we're using ETF data, so exchange traded funds data. Why are we using it? So we don't have non-synchronous problems, right? So for example, currently now, you know, I'm in San Francisco, but the market is already starting to open in New York, but it is closed in Asia. So the information it takes time to travel if we're actually trading in Asia, for example. But if we use ETFs, which are all traded on the same market, we don't have the non-synchronous issues. So that's why we're using that. The methodology we're using is a pairwise Grainger causality test. We calculate degree centrality. So we also use bar estimation, lasso estimation, and there is a composition to calculate different network measures such as degree centrality, cut centrality, and net directional connectedness measures. I will talk a little bit about each of them specifically, but what I wanted to show is it's not just we're looking at returns, right? COVID happened in one country, what happened to returns? Realistically, actually what happened to returns is all of them went down. So when COVID, especially kind of when the global pandemic was announced on March 11th of last year, during that month, returns in all countries went down. That's not what we're interested in, right? What we're interested in is centrality. How central are you? How important are you in the financial network? And that's not necessarily that all of them went down. There are different changes there and different dynamics that I'm interested in discussing here. So in terms of Grainger causality test, what I talk about here is, let's say RIT is one country, so returns of our country I in the future are predicted by different returns of other countries, as well as different instruments, financial instruments such as nominal interest rates and dividend yield. But pretty much what we're interested in is this BIJ coefficient, which pretty much shows that how returns of country J affect the returns of country I. Then we can sum them up over different I's, and then we can calculate for each country J the degree centrality. So how central you are. Again, if you're not central, if something happens, there are many possibilities that a country might have either political instability or financial instability, but it's not going to affect other countries, right? It's just not as big or not as central as other countries. But some countries might be really, you might not have a geographical proximity to them at all, but the financial proximity is really high, right? So in this case, for example, the United States has always been the central country. Recently, we have China coming up and other countries, which I'll show in a second. So for example, our data starts in 2011, and we calculate Grainger causality estimates. We sum them up to calculate the degree centrality, and we see here that United States, was much higher compared to versus different countries. This is just the start, and I'm just going to show that over time, United States has been always higher than all of the countries. But then, as you can see here, it is among them, right? There is no more hegemony, at least what we see. And the question becomes is the forces, right? The feedback effects that have been leading up to this, are they going to continue to stay, or will the United States go up? We're not sure about this. The idea, we're actually thinking that the world is becoming more multipolar, that it's important to understand. It's important to understand the portfolio of other countries, not just think about US-centric perspective. And that obviously, this relationship is really important, not just for financial markets, but also understanding policy. So we're using monthly excess returns, but let's look at more daily, right, minute by minute. And here we also add China. China is red, right? So you see the centrality of China has been increasing, and this is also other countries. So we use 11 countries similar to Rapash. This is the major countries that he had in his research, but of course this model can be extended to other countries as well. But generally what we can see here, especially around initial tariffs, about our World Health Organization announcement, things has been really, China has been really increasing its centrality, for example, and United States has been going down. About election day, well, actually, I just wanted to see it, right? What happened to election day? Prior to election day, there was lots of excitement, and United States centrality has been actually going up, but after that, it went down. So it's really had no effect on keeping the hegemony there. We're using different types of use different types of network measures, obviously, right? We want to make sure our estimates are robust to different methods, to different methodology we use, and different time frequency, and they are. So in this case, we use degree centrality from bar estimation, same results. Using lasso estimation, again, same thing. As you can see here, United States has been always higher, but then it's just among them, right? So it's just among other countries. That's what you can see here. I mean, we can discuss, as John Sterman said, obviously the we have in the paper different kind of about estimates and certainty estimates, right? We want to make sure that they're certain, but generally, and you see that now we cannot differentiate the difference, right? There is no difference between the United States and other countries. We use various decomposition approach, citing Dilbot and Yilmaz's paper. So we use a forecast error variance of a given country, and we decompose it to see how much it is attributable to each other country. So we calculate here the YKJ, for example, for each H time steps ahead. H1 is 1 minute time step ahead, 2 minutes, so on, right? If we use monthly, 1 month, 2 months. And we decompose is due to other countries' effects and calculate the net directional connectedness. This is a different measure compared to degree centrality. Net directional connectedness, this is the equation for it, but pretty much it shows how much you as a country giving problems to others or affecting others minus how much you're affected by others, right? So more, it could be negative, it could be positive. More positive you are, it means you are more central, you're more connected to others, and a problem in your country can spread, can have a contagion to other countries more. Using that measure, again, net directional connectedness, which is totally different measure than the previous ones we showed. It again, the results are really consistent for minute-by-minute returns. China really has been rising up. United States was going down, and again, especially around initial tariffs and COVID-related crisis, this is exactly what is happening. If we zoom in exactly the previous graph, which is hard to see, what pretty much I did here is at each point of time, I look at the maximum, and then I had the color related to the maximum. So in this case, the maximum, say, was always United States, which is in blue. China is in red, right? So around, for example, the announcement of global pandemic, China really rose up, right? But after this, you see it's a kind of multicolored palette here, which pretty much says that there is really non-dominant. I mean, we see China, but it's also, I wouldn't just kind of have it where the error estimate is, there's lots of other countries that have become dominant, so becoming more multipolar world. We also have done for each snapshot, we just kind of showed 4 different snapshots. We made network diagram with the size of a ball. So each country is a node, and the size of that node shows how central you are, how important you are, right? United States, we have seen it right before pretty much 2018. United States was bigger, more central. Other countries not. China became really central. This is specific time actually what happens in March, right before global pandemic announcement. But recently, you can see here a very friendly, more or less equally weighted node structure. Empirical findings, what we find that US-China trade war of 2018-19 diminished US centrality in financial system. COVID outbreak, what we just learned from 2 previous presentations, made things even worse. It increased centrality of China and United States relative centrality has been going down. The question is, will it continue to stay or not, right? So the point is, compared to previous papers, what we're saying is what we have learned is relevant, is not just for epidemiological or policy studies related to epidemiology. This is related to financial markets as well, across the globe. And this could be the first signals that the global financial system is moving from a unipolar to bipolar, multipolar world. Many times, when you go and read some kind of Wall Street Journal or New York Times article, there's kind of articles now more and more you see about this. The United States going down, China going up, or other countries picking up the slack. So it is happening, right? And this is, we're just providing kind of the first ones to provide the specific modeling and data analysis to put it all together. So just to kind of, what are exponential explanations? I'll just throw some there. I would love to hear your ideas, please. One idea is United States was the largest trading partner to all other countries. It's not more anymore, right? This is 1995, and this is the recent picture, right? United States, this is the major, this is what we call the export partner share. It was the largest, it's not anymore. The market capitalization, right? So the relative size of US market in the global portfolio is declining. So if you're thinking about, if you're holding, say, the global portfolio, how much of that weight is United States? Before, it used to be huge, big percentage. Now it is still big, but it's decreasing in other countries. So China is increasing, for example, red, United States is blue, it is decreasing, but the other countries isn't. What is it, Jordan? 1 minute? 5 minutes?
1 minute.
1 minute. Okay, great. Okay. So let me just finish, because I would love to hear your comments as well. Other suggestions could be dollarization and the rise of the use of renminbi is important. And if you are in Europe, you heard a lot about Belt and Road initiatives, which is kind of a foreign policy behind the Silk Road, and that's serious matter as well. That is to be important to consider in the modeling. But anyway, I just want to stop here. Thank you, and I would love to hear your suggestions, because we would love to submit this paper soon, but we would love to understand the other forces behind what we're seeing, and are we seeing this, is it just the end, like, is it multipolar world, or do you think it's kind of a more transitory state? Thank you very much.
Thank you very much, Dr. Getmansky-Sherman, for this talk. And let's open it up for questions and answers. A first question came in, but that is actually a question that came in before you came up with a number of potential explanations. The question was about what potential reasons could you give. But there's a follow-up question there, and that asks, in terms of the changing centrality trends, is there empirical results for your work or others to offer a ranking of these hypotheses? So can you say a little bit more about which is more likely based on the empirics?
Yes, and no, this is really, and I think I see Hajir, thanks a lot for the questions. This is, so for now, we have not ranked them, because we would like to just see what are important hypotheses. So this is where at the stage of research, which is exciting when you present, because you're not just presenting finished published work, but actually I'm asking you guys, what do you think, right? And I would love to incorporate your suggestions. So this is kind of, I think what we put, the suggestions were in the order of we thought were important, such as export, the related stuff related to export, for example, and financial, the smaller weight. So for example, when people are investing, they're putting now less weight in United States stock market capitalization compared to other countries, for example. So, but we have not ranked them. I would love to rank them. This is a great idea. But I would like to also hear if you have any other ideas, and some things like Silk Road initiatives, I don't even know how to rank it. This is a policy, right? So this is actually interesting. If a big question is the United States' kind of hegemony is going down, and we're now sharing the world with other countries, there are other reasons, epidemiological, policy, just investment suggestions, which are great to take into account, and I would love to rank them. So this is a great idea. Thank you.
There's a follow-up question that relates a little bit more to the understanding or characterizing these shifts. There's a lot of noise in the, from short period to short period. We saw China going up and down in terms of centrality in the last period. Can you say a little bit more about different regimes, when particular US lost centrality and others when China came up, or when sort of it became more diversified?
Yeah, and this is a good question. We had also, I remember we presented this a month ago, where is a question like, can you take China out and see the same effects? And we did see the same effects, right? So that's kind of, so we try to take one country out and just see if it's because of China or not. But I would say China stuff started to come out pretty much at the around beginning of the Trump, era, the trade wars. That's when centrality actually. So this is unintended consequences, right? You will think that when a president of the United States says something about let's kind of make America stronger and start the war, there could be unintended consequences, but actually it can lead to more with China investing in their own country and other countries potentially looking for China as a leader and leading to centrality. So that's also kind of a lesson in unintended consequences there.
There's a related question that not talks about sort of the drivers of it, but also the consequence in terms of, do you see increased volatility or chance of black swan events going up during this transition compared to prior dominant regime of, let's say, one player, in this case the US? But that's maybe more often thinking about outside your region.
Yeah, exactly. So black swans gone up during transition compared to prior. So, John, can you maybe mention what you mean here? Because we have seen United States before was just always dominance, or no black swans. What can you maybe mention?
So as China and other countries are contending for dominance and becoming, the reserve currency or the default investment, there's a lot more uncertainty here. And the question is whether that increases the volatility in all markets compared to the prior regime, and drive everybody into a search for cash, basically.
Yeah, that's a great question. So pretty much, let's see if
in other words, it's not just a question of which nation becomes dominant and the home for much of the world's capital, but does this process increase the risk that everybody faces, no matter where they're investing?
Yeah, exactly, and that's a great. So it's kind of touches on both systematic and systemic risk, right? So the systematic risk component is here. If I look at the so generally in the finance, finance 101, adding more countries or adding more assets, it's better for risk, right? The risk is reduced. But if there is a feedback mechanism that it just increases uncertainty across everything, it actually will not happen, right? You could actually increase the risk by doing this. So that's a question. We have not started that. And a bigger question is also the systemic risk of a whole country, of a whole world, actually, right? If now you are so interconnected, can it potentially lead to systemic risk? We have another paper with the same actually co-authors, Andrew, Loriana, and Monica, on systemic risk, and systemic risk has been on the rise, right? That's definitely what we have seen. We kind of go more specifically, rise on what? This is more country related, right? Where we're looking at which financial institutions are responsible. But this is a great question in terms of, is the whole world becoming a little bit more unstable or not because of this, right? This is I don't know, you know, what do you guys think? I mean, this is a really interesting question, right? I don't know, John, do you have any kind of thoughts about it?
What I suggest is to continue this discussion on this part for the discussion session, so that we can address a few more questions that have been coming in. So some of them talk about the historical path. It's, as you already mentioned yourself, it's been going on for a while. And so any thoughts about that, and also regarding historical hypothesis regarding this?
Yeah, and you know, and this is, I will just kind of share, I think, I don't know if I can share it. This is the end of the conclusion of our paper, and it's kind of also related to this and John's question. It's there's a, I'm not sure if I'm not Greek, I cannot pronounce it correctly, but Thucydides is trap, right? So that's kind of a historical. So what is happening is when we have hegemony of one country is being touched on, you know, and there's a competition, right? And another country, so we have two hegemons. Sometimes it can lead to a big, so sometimes you can get to this Thucydides trap, right? So instead of like sharing ideas about vaccines, instead of sharing ideas about policies, and so instead of, you know, sharing the modeling across different countries, you can have this trap where people like now really in this competitive zone. So this could be an interesting kind of system dynamics hypothesis to test it and to see what comes out of it, right? Potentially what we're saying, multipolar world could be great, right? I mean, we learn from each other. There's a more share of information. All other countries are on the equal standing, which could be wonderful, right? But we want to make sure we do not fall into this trap that people will start destroying, and that will lead to a higher volatility. Sorry, go on.
Mila, thank you very much, and I'm sorry to interrupt you. We are out of time. As said, we continue the discussion tomorrow, and we have certainly lots of food for conversation. And I would like to thank again the speakers for the wonderful presentations and work, and for the questions by the audience. I look forward to seeing you at other moments in the conference. Thank you.
Thanks, Yaron.
Thank you, everybody. See you at the conference.